one reason that it's important to think specifically about perinatal mental health is that the effects of the symptoms that people are experiencing can extend beyond the person who's having those symptoms. So, for any psychiatric disorder, we're concerned about that person's experience. We know that the symptoms are distressing, that people want help with them. And we also know that psychiatric illness is kind of a leading cause of disability worldwide. So it causes impairment at work, it causes impairment in terms of what people are able to do at home. So we want everybody, regardless of whether they've recently had a baby or not, to be able to get help if they're experiencing depression or anxiety. But when we're talking about new and expectant parents, we've also got the family to consider. And we know that depression and anxiety, both during pregnancy and during the first year of a baby's life, is not good for fetal development, it's not good for child development, and it's not good for the family. So we know that women who experience depression and anxiety during pregnancy have higher rates of poor birth outcomes. They're more likely to give birth preterm. Their babies are more likely to be born at a low birth weight, and they're even more likely to experience preeclampsia, which is a really severe birth complication and one of the leading causes of preterm birth in the United States. So the fact that depression and anxiety can increase this risk, we're really concerned about the effects that it might have on fetal development and birth outcomes. After the baby is born, depression and anxiety can also cause other problems for child development. So we know that moms who are depressed and anxious when their babies are young interact differently with their babies. And there's some evidence that this might be related to long-term, more negative outcomes for those kids. So they might be more at risk for impaired cognitive development or for behavioral problems, or even be more likely to experience their own depression or anxiety. And this isn't just true for moms, it's also true for dads. So dads who are depressed or anxious during the first year of their baby's life interact differently with their children, and their children have different long-term outcomes. And it's not just about the baby, it can also affect the couple's relationship. So the depression or anxiety of your partner has a really strong influence on your own depression and anxiety. So having a partner who is depressed or anxious can be a risk factor for developing depression and anxiety, and it can also lead to impaired relationship satisfaction, conflict in the marriage. So really, depression and anxiety, regardless of whether it's mom or dad who's experiencing it, regardless of whether it's pregnancy or after the baby is born, it's not just affecting mom and dad, it's affecting the whole family.